Hi everyone, welcome back to my channel. I'm Sarah Zhou and I founded CareBridge, which is a youth-led initiative that aims to bridge the healthcare accessibility gaps around the world. This is the second video of the series where we'll discuss how AI can be used to improve healthcare. Today we're going to go over how AI can be used to predict health risks. If you're interested, please subscribe and click the like button to support my channel. Today, we're diving into one of the most transformative applications of AI in modern healthcare, predicting health risks before they become critical. You could think of it as a crystal ball, but powered by data and algorithms. By the end of the session, you'll understand how AI can analyze patterns in patients' medical history, lifestyle choices, and even genetic data to forecast risks like diabetes, heart disease, or hospital readmissions. More importantly, we'll explore how these predictions empower individuals and providers to take proactive steps like personalized wellness tips to stay ahead of any health issues. Before we dive in, here's the agenda. We'll start by defining health risk prediction and why it's a game changer. Then we'll go over how AI can outperform traditional methods, what data fuels these models, and the algorithms that make it all possible. We'll walk through real-world case studies like how AI predicts diabetes or reduces heart attack readmissions. We'll also address the challenges like privacy, bias, and trust, and how to navigate them. Finally, we'll glimpse into the future. Imagine having AI-powered genomics and smart devices that monitor your health in real time. Introduction to health risk predictions. So, what exactly is health risk prediction? Imagine a system that flags your risk of developing high blood pressure next year based on your diet, stress levels, and family history. That's the core idea, using data to spot trouble before symptoms appear. Why does this matter? Well, WHO, the World Health Organization, estimates that 80% of heart disease and diabetes cases could be prevented with early action. Instead of waiting for a crisis, we shift to prevention, saving lives and reducing the $4 trillion global cost of chronic diseases. The role of AI in predictive healthcare. You might ask, why AI? Can't doctors do this? Absolutely, but AI scales what humans can't. Let's compare. Traditional risk models use basic factors like age and BMI, body mass index. AI, on the other hand, processes thousands of data points like your sleep patterns, genetic markers, and even how often you refill prescriptions. It's faster since it can analyze a decade of EHR's electronic health records in seconds. It's sharper as well, spotting trends like a slow decline in kidney function that humans might miss. And it's personal. Instead of giving generic advice, AI can tell patients based on your data, you should cut sodium intake to avoid hypertension or high blood pressure. AI isn't a replacement for doctors and physicians by any means, but it can augment today's healthcare system. Data sources for health risk analysis. Data is the fuel for AI, and healthcare generates a lot of it. Let's break it down. Structured data includes things like EHRs, your lab results, prescriptions, and blood pressure readings. Unstructured data is trickier as it includes doctors' notes buried in paragraphs, MRI images, or even Fitbit sleep logs. AI uses NLPs, which are natural language processing, to extract insights from those notes, like patient reports chest pain after exercise. Then there's external data, your genetic profile, zip code, which impacts air quality and food access, or even social media patterns. Combining these layers creates a 360-degree risk profile, but it's not without challenges, which we'll tackle next. Data preprocessing and integration. Raw data is messy. EHRs can have typos, missing entries, or conflicting formats. The first step is cleaning, removing duplicates, filling gaps like estimating missing cholesterol levels, and standardizing units, pounds versus kilograms. Then integration, merging your Apple Watch data with hospital records. It sounds simple, but systems often don't talk to each other. Interoperability standards like FHIR Fast healthcare interoperability resources help, but privacy is the challenge. How do we aggregate or group data without exposing identities? Techniques like federated learning train AI models across decentralized datasets without sharing raw data. It's complex, but critical for accurate predictions. By the way, interoperability is computer systems' ability to exchange and use information. Key AI algorithms for risk prediction. For basic risk scoring, logistic regression, a machine learning model is the most reliable option. It might weigh age, smoking status, and cholesterol to output a diabetes risk percentage. But health data is rarely linear. Random forests, a machine learning algorithm, handles nonlinear relationships, like how obesity and genetics interact to amplify heart disease risk. For massive data sets, gradient boosting, like the machine learning algorithm XGBoost, excels, iterating to correct errors. Then there's deep learning. RNNs analyze time series data, like glucose trends over months, while CNNs parse X-rays for early tumors. The key is matching the algorithm to data type and clinical question. Advanced AI techniques. Beyond traditional machine learning, newer techniques are pushing boundaries. Natural language processing, for instance, scans clinical notes for red flags. A mention of fatigue and weight loss could signal undiagnosed cancer. Transformer models like BERT go further, understanding context. Family history of breast cancer versus patient denies family history. Then there is explainable AI, XAI. If a model says high stroke risk, clinicians need to know why. Was it the patient's AF, atrial fibrillation, or their sedentary lifestyle? Explainable AI tools like Lime highlight contributing factors, building trust and ensuring recommendations are actionable. Steps to implement AI-driven risk prediction. Now let's talk about implementation. First, data collection. Partner with hospitals for EHRs, insurers for claims data, and wearable companies for real-time metrics. Next, model training. Use historical data where outcomes are known, like which patients develop diabetes to teach the AI. It's important to validate it on fresh data to avoid overfitting. Deployment is the most challenging part. Integration into EHR workflows is key. Finally, continuous learning. As new data flows in, models should be continuously retrained to maintain accuracy. Case Study 1, Diabetes Prediction. The first case study is diabetes prediction. A hospital system trained an AI model on 50,000 EHRs, including glucose levels, BMI, and lifestyle surveys. The model was a random forest classifier. Result was 92% accuracy in flagging prediabetes 6 months before clinical diagnosis, but it didn't stop there. For high-risk patients, the AI generated tailored plans like walk 30 minutes daily or reduce sugary snacks. 1 year later, the intervention group saw a 40% lower progression to diabetes. This is just one example of AI preventing in addition to predicting. Case study 2 is cardiovascular risk assessment. So another example is a clinic integrating wearable ECG data, which is a recording of heart activity, with AI to predict heart attacks. The model analyzed blood pressure, cholesterol, and real-time heart rhythms from smartwatches. When irregular patterns emerged, like asymptomatic arrhythmias, it alerted providers. The result was a 30% drop in 90-day readmissions post-heart attack. Patients also received AI-generated tips. Avoid high-sodium meals this week based on blood pressure trends. This fusion of wearables and AI turned passive monitoring into proactive care. Benefits of AI in preventive care. If we zoom out for patients, AI demystifies health risks. Instead of a vague exercise more, they get Your osteoporosis, which is a decrease in bone density and mass risk, is high. Prioritize calcium and weight-bearing exercises. For providers, it's a decision support tool. Imagine an ER doctor seeing a high sepsis risk alert for a patient with rising fever and white blood cell counts. Catching this early would save lives. System-wide, AI optimizes resources. Hospitals can prioritize high-risk cohorts for follow-ups, reducing ER overcrowding. Challenges and ethical considerations. But it's not all smooth sailing. First, privacy. How do we use data without violating trust? Techniques like differential anonymity add noise to datasets to mask identities. Second, bias. If AI trains on data skewed towards affluent populations, it might underserve minorities. Fixing this requires diverse datasets and fairness audits. Third, clinician buy-in. Many still prefer intuition over algorithms. Education is key, so showcasing AI as a tool, not a replacement. Lastly, regulation. The FDA now approved AI-based diagnostics, but standards are evolving. Ethics must keep pace with innovation. Future trends in AI-driven healthcare. The future is bright. Predictive genomics will let AI flag BRCA1 mutation carriers for early breast cancer screening. Federated learning will enable global collaborations. IoT, which is the Internet of Things, a network connecting physical objects to the internet integration, means smart inhalers tracking asthma triggers or insulin pen advising doses in real time. And maybe the most impactful part is democratizing AI, making it accessible for everyone. Low-cost tools could bring early diagnosis to rural clinics, bridging the healthcare accessibility gaps. Conclusion. In conclusion, AI can transform healthcare from reactive to proactive. Predicting risks earlier could empower individuals and providers to act, whether through personalized tips or targeted interventions. Success hinges on quality data, ethical practices, and collaboration across tech, medicine, and policy. The call to action is to invest in interoperable systems, prioritize explainability, and ensure AI serves all populations equitably. Together, we can turn prediction into prevention and prevention into longer, healthier lives. Thank you for your time today. If you want to learn more, I recommend Eric Topol's book on deep medicine for a deep dive on AI's role in healthcare. The WHO's digital health guidelines are also a great resource. Remember to subscribe and click the like button to support my channel. I hope to see you in the next video. Bye!